ನಮಸ್ಕಾರ. ಆರೋಗ್ಯ ಕಾಳಜಿ ಮಾತುಕತೆಗೆ ಸ್ವಾಗತ. ಇದು ಮಂಗಳೂರಿನ ಪಳ್ನೀರಿನಲ್ಲಿರುವಂಥ ಯೂರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಸಂಸ್ಥೆಯವರು ಆಯೋಜಿಸ್ತಾ ಇರುವಂಥ ಆರೋಗ್ಯ ಕಾಳಜಿ ಕಾರ್ಯಕ್ರಮ. ಇವತ್ತಿನ ಮಾತುಕತೆಯಲ್ಲಿ ನಾವು ಕಿಡ್ನಿ ಸಮಸ್ಯೆ ಬಗ್ಗೆ ಮತ್ತು ಅದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟ ಚಿಕಿತ್ಸೆ ಬಗ್ಗೆ ಮಾತಾಡಲಿಕ್ಕಿದ್ದೇವೆ. ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ನಮ್ಮ ಜೊತೆಗೆ ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿ ಭಾಗವಹಿಸಿದ್ದಾರೆ ಡಾಕ್ಟರ್ ಐಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು. ನಾನು ಡಾಕ್ಟರ್ ಐಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರನ್ನು ಈ ಒಂದು ಮಾತುಕತೆಗೆ ಸಮಸ್ತ ವೀಕ್ಷಕರ ಪರವಾಗಿ ಪ್ರೀತಿಯಿಂದ ಸ್ವಾಗತ ಮಾಡ್ತಿದ್ದೀನಿ. ಡಾಕ್ಟರ್ ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ.
ಎಸ್ ವೀಕ್ಷಕರೇ, ನಾನು ಈಗಾಗಲೇ ಹೇಳಿದಾಗೆ ಇವತ್ತಿನ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ನಾವು ಯೂರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಮಂಗಳೂರಿನ ಯೂನಿಟಿ ಹಾಸ್ಪಿಟಲ್ನ ಎದುರುಗಡೆ ಅಂದರೆ ಪಳ್ಳಿ ರಸ್ತೆಯಲ್ಲಿ ಈ ಒಂದು ಕ್ಲಿನಿಕ್ ಇರುವಂಥದ್ದು ಯೂರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್. ಈ ಒಂದು ಯೂರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ನವರು ಆಯೋಜಿಸ್ತಾ ಇರುವಂಥ ಮಾತುಕತೆ ಇದು. ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ನಮ್ಮ ಜೊತೆಗೆ ಇವತ್ತು ಮುಖ್ಯ ಅತಿಥಿಯಾಗಿ ಭಾಗವಹಿಸ್ತಿರೋರು ಡಾಕ್ಟರ್ ಐಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು ವಿಶೇಷವಾಗಿ ಕಿಡ್ನಿಯ ಹಿರಿಯ ತಜ್ಞರು. ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಅವರ ಬಗ್ಗೆ ಒಂದು ಮಾತನ್ನು ಹೇಳಿ ಆಮೇಲೆ ನಾನು ಇವತ್ತಿನ ಮಾತುಕತೆಗೆ ಬರ್ತೇನೆ. MBBS MD ಅದು ಜನರಲ್ ಮೆಡಿಸಿನಲ್ಲಿ, ಆಮೇಲೆ DRNB ನೆಪ್ರಾಲಜಿ ಅಂದರೆ ಸೂಪರ್ ಸ್ಪೆಷಾಲಿಟಿ ಒಂದು ಅರ್ಹತೆ ಇರುವವರು. ಜೊತೆಗೆ ಮಂಗಳೂರಿನ ಯನಪೋಯ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮತ್ತು ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಅಸಿಸ್ಟೆಂಟ್ ಪ್ರೊಫೆಸರ್ ಆಗಿ ನೆಪ್ರಾಲಜಿ ವಿಭಾಗದಲ್ಲಿ ಕಾರ್ಯನಿರ್ವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ಒಬ್ಬ ತಜ್ಞ ನೆಪ್ರಾಲಜಿಸ್ಟ್ ಮತ್ತು ರೆನಿಯಲ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಫಿಸಿಷಿಯನ್ ಆಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸ್ತಾ ಇರುವವರು. ಕಿಡ್ನಿಯ ಸಂಬಂಧಪಟ್ಟಂತೆ ಎಲ್ಲ ವಿಶೇಷ ಮತ್ತು ತಜ್ಞತೆ ಮತ್ತು ಪರಿಣತೆಯನ್ನು ಹೊಂದಿರುವಂಥವರು ಡಾಕ್ಟರ್ ಐಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು. ಇವತ್ತಿನ ಮಾತುಕತೆಯಲ್ಲಿ ನಾವು ಮಾತಾಡ್ತಾ ಇರುವಂಥದ್ದು ಕ್ರಾನಿಕ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್ ಬಗ್ಗೆ, ಅಂದರೆ ಕಿಡ್ನಿಗೆ ಸಂಬಂಧಪಟ್ಟ ತೊಂದರೆ ಬಗ್ಗೆ ಮತ್ತು ಅದರಲ್ಲಿ ಕೂಡ ತೀವ್ರ ಸ್ವರೂಪದ ತೊಂದರೆ ಬಗ್ಗೆ, ಮತ್ತು ಯಾವ ಕಾರಣಕ್ಕೆ ಈ ರೀತಿಯ ತೊಂದರೆಗಳು ಬರುತ್ತೆ ಮತ್ತು ಯಾವ ಸಂದರ್ಭದಲ್ಲಿ ನಾವು ವೈದ್ಯರನ್ನು ಭೇಟಿ ಮಾಡಬೇಕು, ಜೊತೆಗೆ ಯಾವ ರೀತಿಯ ಟ್ರೀಟ್ಮೆಂಟ್ ಬೇಕು, ಮತ್ತು ಅವರು ಯೂರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಸಂಸ್ಥೆಯಲ್ಲಿರುವಂಥ ಏನು ಸೌಲಭ್ಯ ಇದರ ಬಗ್ಗೆ ಕೂಡ ಮಾತನಾಡಲಿಕ್ಕೆ ಇದ್ದಾರೆ. ನಾನು ಈ ಒಂದು ಮಾತುಕತೆಯನ್ನು ಮಾತನಾಡೋ ಸಂದರ್ಭದಲ್ಲಿ ಡಾಕ್ಟರ್ ಐಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು ಇಂಗ್ಲೀಷ್ನಲ್ಲಿ ಒಂದಷ್ಟು ವಿಚಾರಗಳನ್ನು ಹಂಚಿಕೊಳ್ಳಿಕ್ಕೆ ಇದ್ದಾರೆ. ಮತ್ತೆ ಒಂದಷ್ಟು ಕನ್ನಡ ಕೂಡ ಅವರು ಮಾತಾಡ್ಬೋದು, ನಾವು ನೋಡೋಣ. ಎಸ್ ಡಾಕ್ಟರ್, ಐ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ದ ಶೋ. If you kidney, I told in the beginning itself, we'll speak about the kidney issues and all. What is the importance of kidney in a human anatomy?
Kidneys, even though they are very delicate organs, they perform numerous and vital functions in the body. I think most of the people might have thought the main function of kidney is only to remove the waste products. But in fact, more than that, it performs many other functions also. As everybody,
ವೈದ್ಯರು ಹೇಳೋ ಪ್ರಕಾರ ಜನರು ಹೆಚ್ಚಾಗಿ ಕಿಡ್ನಿ ಅಂತ ಹೇಳಿದ್ರೆ ಅದು ಆ ದೇಹದಲ್ಲಿರುವ ಕಲ್ಮಶ ತ್ಯಾಜ್ಯಗಳನ್ನು ಹೊರ ಹಾಕಲಿಕ್ಕೆ ಮಾತ್ರ ಇರುವಂಥ ಒಂದು ಅಂಗ ಅಂತ ತಿಳ್ಕೊಂಡಿರ್ತಾರೆ ಅಂತ. ಬಟ್ ಅದಕ್ಕಿಂತಲೂ ವಿಶೇಷವಾದ ಕೆಲಸ ಕಾರ್ಯಗಳು ಇದಾವೆ ಅಂತ. ಎಸ್ ಡಾಕ್ಟರ್, ಪ್ರೊಸೀಡ್.
Apart from removing waste from the body, it also plays important role in removing fluid from the body. Excess fluid which is present in the body is removed to maintain a euvolemic state. And it also plays an important role in maintenance of an acid-base balance. So that is why when there is severe kidney disease, or when kidney disease is so severe that GFR is less than 10, we see that there is severe acidosis. Acid content in the blood rises to a high level. That leads to a problem called what we call as metabolic acidosis, where we'll have to do the dialysis. And apart from that, it also plays important role in maintenance of calcium. Production of a hormone called erythropoietin that will keep the hemoglobin in the normal range. If there is severe kidney disease, this hormone is less produced, and that also leads to anemia. And
how it maintains the calcium, you told?
Yes. It plays a very important role in maintenance of this calcium and phosphorus. Thus, the bone mineral disease is prevented. When there is severe kidney disease, what happens is the calcium level will come down, and automatically there is a hormone called PTH, parathyroid hormone.
ಕ್ಯಾಲ್ಸಿಯಂ ಅಂಶವನ್ನು ಅದು ಏನು ಸಮತೋಲನ ಮಾಡಿಕೊಳ್ಳುವಲ್ಲಿ ಕೂಡ ಕಿಡ್ನಿ ಅದು ಬಹುದೊಡ್ಡ ಪಾತ್ರ ಇದೆ.
The phosphorus level will go up, and all these also will increase the risk of heart disease. That is what we call as cardiovascular disease. Hence, even though kidneys are very delicate organ, it is receiving some 1/4 or 25% of the cardiac output.
So if something happen or some imbalance happens in kidney, then it will be reflected in the heart also.
Yes, yes, yes. That we,
ಕಿಡ್ನಿಯ ಆರೋಗ್ಯ ಅಥವಾ ಸಮತೋಲನದಲ್ಲಿ ಹೆಚ್ಚು ಕಡಿಮೆ ಆದರೆ ಅದು ಕೊನೆಗೆ ಹೃದಯಕ್ಕೆ ಕೂಡ ಸಮಸ್ಯೆಯಾಗಿ ಕಾಡುತ್ತೆ ಅಂತ.
yeah. So it also helps in maintaining the within the normal hemoglobin. It also produces vitamin D, active vitamin D. Nowadays, I think many of the people are concerned about what is my vitamin D level. This active form is produced within the kidney. The hydroxylation is occurring in the kidney. So
ವಿಟಮಿನ್ ಡಿ ಉತ್ಪತ್ತಿಯಲ್ಲಿ ಕೂಡ ಕಿಡ್ನಿಯದು ದೊಡ್ಡ ಪಾತ್ರ ಇದೆ. Yes, doctor, if you come to the disease particularly, how can you categorize the kidney disease?
Kidney disease we can broadly categorize into two. One is acute kidney injury, second is chronic kidney disease. As the term, see, acute means it is sudden in onset. And the best thing about acute kidney injury is that it will recover completely once we find what has led to the acute kidney injury. And while chronic kidney disease, as the term suggests only, it is a chronic disease and it is a progressive disease. It progresses, and what is our role is to reduce the rate of progression, and we'll try to terminate, or maximum will try to reduce the rate of progression.
What are the stages in this?
Yes. CKD we can divide into 5 stages. This is based on what we call as filtration rate. The filtration is occurring in the kidney. The word what we use is GFR, glomerular filtration rate. When the normal GFR of a person is between 120 to 130 ml per minute. When the GFR comes down, the CKD or chronic kidney disease becomes to a higher level of stage. So stage 1 is the stage where the GFR is more than 90, which is normal, but there is already some structural damage to the kidney. And stage 2 is between 60 to 90. Between 60 to 90 of GFR is what we call as stage 2. And stage 3, the GFR is between 30 to 60. Stage 3 itself we can divide into 2, 3A and 3B. 3A, the GFR is between 46 to 60, and 3B, the GFR is between 30 to 45. And stage 4, the GFR is between 16 to 29. And the stage 5, the GFR is less than 15 or 15. So it is the stage 5 which is the stage where patients will have more symptoms of chronic kidney disease. So unless the patient reaches to the final stage or CKD stage 5, what many of us call as end stage renal disease, we develop the symptoms which we call uremic symptoms. So till stage 4 there may not be any symptoms. That is one thing. Patient can be asymptomatic till the final stage or stage 5.
ಪ್ರಕಾರ ಇಲ್ಲಿ 5 ಹಂತಗಳಲ್ಲಿ ಕಿಡ್ನಿ ಸಮಸ್ಯೆಯನ್ನು ಗುರುತಿಸಲಾಗುತ್ತೆ. ಅದರಲ್ಲಿ 4ನೇ ಹಂತ ತನಕ ಕೆಲವೊಂದು ಸಿಂಪ್ಟಮ್ಸ್ ಇರೋದಿಲ್ಲ.
Yes. And chronic kidney disease, by definition we'll tell only when the kidney disease is present for 3 months or more. That is the main difference between acute kidney injury, AKI, or CKD. Acute kidney injury is completely reversible. Chronic kidney disease means there is some damage which is occurring to the kidney which is present for 3 months or more than that. And 3 months is a very short period. Hence it is very, very important that we should be knowing it. What are the symptoms of it, and when should we be really vigilant, and that is really important.
Doctor, what are the causes for this kidney disease?
When you tell the causes of, when we ask the cause of CKD, the most important cause worldwide, not only in India, even in USA, it is the diabetes mellitus. It can be type 1 diabetes or type 2 diabetes mellitus. More than 1/4. In some of the literature, it is 25% of the kidney disease is due to diabetes. In some literature, up to 40% of kidney disease is due to diabetes mellitus. So the long standing diabetes mellitus can cause end organ damages, including kidney disease, which will reflect as chronic kidney disease or diabetic nephropathy.
ವೈದ್ಯರು ಹೇಳೋ ಪ್ರಕಾರ ಡಯಾಬಿಟಿಕ್ ಏನು ನಾವು ಮಧುಮೇಹ ಅಂತ ಹೇಳ್ತೇವೆ, ಸಕ್ಕರೆ ಕಾಯಿಲೆ ಅಂತ ಹೇಳ್ತೇವೆ, ಇದೇ ಬಾರಿ ದೊಡ್ಡ ಮೂಲ ಕಾರಣ ಅಂತ ಅದರ್ ದೆನ್
diabetes, then the next important cause is systemic hypertension. Systemic hypertension itself can cause chronic kidney disease, and the other thing is
hypertension related to kidney disease.
Yes. Hypertension itself,
BP ಅಂತ ನಾವು ಹೇಳ್ತೇವೆ.
yes.
BP ಕೂಡ ಒಂದು ಕಾರಣ ಅಂತ ಹೇಳ್ತಾರೆ ಡಾಕ್ಟರ್.
And the opposite also will happen. As I told, one of the function of kidney is to regulate the blood pressure, to maintain the BP in the normal range. So once there is kidney disease, again the blood pressure goes up. So both hypertension can lead to kidney disease, as well as kidney disease itself will lead to hypertension, which we call secondary hypertension.
ಎರಡು ತದ್ವಿರುದ್ಧ ಕೂಡ ಆಗಬಹುದು. ಕಿಡ್ನಿ ಸಮಸ್ಯೆಯಿಂದಾಗಿ BP ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗಬಹುದು, ಅಥವಾ BP ಹೆಚ್ಚು ಕಡಿಮೆ ಆದ್ರಿಂದಲೂ ಕಿಡ್ನಿ ಸಮಸ್ಯೆ ಬರಬಹುದು ಅಂತ.
So the other causes apart from diabetes and hypertension, it can be any obstruction, like the kidney and the urinary tract. If there is any obstruction commonly we see in the form of stones, what we call medical term renal calculi. Calculi can be there anywhere within the from the kidney till the urethra. It can be within the kidney, it can be in the ureter, it can be in the urinary bladder. When both kidneys are obstructed by stones, so there is obviously there is obstruction in the flow of urine. It can lead to obstructive nephropathy, that if it is present for a long duration, as I told, 3 months or more, it can lead to chronic kidney disease. Hence diagnosing or screening for an obstruction is very, very important.
Doctor, what is the symptoms we can in the earlier stage we'll get it.
The symptoms means CKD, chronic kidney disease, it can be asymptomatic, as I told, till stage 4, and in stage 5 many of the patients will present to us unfortunately at stage 5 or end stage renal disease. And
sometimes people used to say that we had no symptoms at all, suddenly it occurred.
Correct. We see very commonly that young people,
ಎಷ್ಟೋ ಮಂದಿ ದಿಢೀರಾಗಿ ನಮಗೆ ಏನು ಕಿಡ್ನಿ ಸಮಸ್ಯೆ ಕಾಡಿತ್ತು, ಯಾವ ಲಕ್ಷಣಗಳು ಕೂಡ ಇರಲಿಲ್ಲ ಅಂತ ಹೇಳೋದೆಲ್ಲ ಇರುತ್ತೆ. ಯಾಕೆ ಅಂತ ವೈದ್ಯರು ಹೇಳ್ತಾರೆ.
Commonly we see some young people coming at the age of 25-30 years with complaints of severe headache. This headache is due to hypertension, and hypertension occurred due to the kidney disease. And at the time of diagnosis, when we send the serum creatinine, it can be 10-11. Unfortunately, that is the time when they have been diagnosed with kidney disease, and that is already stage 5 or end stage renal disease. And once that stage is reached, there are only 2 options. That is either dialysis. Dialysis can be done either hemodialysis or peritoneal dialysis. And the second option is renal transplantation. Renal transplantation is the best option, especially in people who are young. And the treating nephrologist, the transplant physician has to decide which patients has to go for renal transplantation and which patients has to be continued on hemodialysis.
Doctor, in some other disease, we'll get symptoms somewhere in the body, either somewhere in the part of body. Why don't we can get any symptoms?
Yes. That can have that is the thing. The kidneys, even if the GFR, as I told, GFR normal is 120 to 130, even the GFR is 18 or 20, the patients will not have any symptoms. But the very important symptom which people neglect is frothiness in the urine. When sometimes that may be the only symptom, as I told, in 25-year-old, 30-year-old who come to OPD and detect to have creatinine of 12, they may be having frothiness in the urine when they pass urine in the toilet, and they may be noticing that once they flush, still the bubbles are there, the frothiness is persisting, and the next person is going to the toilet and they will be telling that why you are not flushing. It is actually due to the protein which is being excreted in the urine. So
ಸಾಮಾನ್ಯವಾಗಿ ಕೆಲವು ಸಂದರ್ಭದಲ್ಲಿ ಕಾಣಬಹುದು ಅಂತ ಹೇಳಿದ್ರೆ ಮೂತ್ರ ಮಾಡಿದ ನಂತರ ಕೂಡ ಏನು ಆ ನೀರಿನಲ್ಲಿ ಗುಳ್ಳೆಗಳು,
ಪ್ರೋಟೀನ್,
ನೀವು ನೀರು ಹಾಕಿದ ನಂತರ ಕೂಡ ಕಾಣ್ತದೆ ಅಲ್ವಾ, ಅದು ಒಂದು ಲಕ್ಷಣ ಅಂತ.
Yes. So the protein in the urine is one thing which we have to screen for. That is very important. So the symptoms is frothiness in the urine. Frothiness in the urine. Once anybody is seeing any frothiness can be seen even when we have fever or when we do exercises. After a strenuous physical exercise, after we going for gym for 30 minutes, and if you pass urine, you may see bubbles. That is physiological. But it becomes pathological when every day when you pass urine in the toilet you are seeing that it is coming as bubbles. That means possibly you may be excreting.
ಸುಲಭವಾಗಿ ನಾವು ಸ್ವತಃ ಅರ್ಥ ಮಾಡಿಕೊಳ್ಳಿಕ್ಕೆ ಸಾಧ್ಯತೆ ಇರುವಂಥದ್ದು ಒಂದು ಮೂತ್ರ ಏನು ಮಾಡಿದ ನಂತರ ಸಾಮಾನ್ಯವಾಗಿ ಅದರಲ್ಲಿ ನೀವು ಫ್ಲಶ್ ಮಾಡಿದ ನಂತರ ಕೂಡ ಅಲ್ಲಿ ಬಬಲ್ಸ್ ಗುಳ್ಳೆಗಳು ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ ಬಹುಶಃ ಒಮ್ಮೆ ಚೆಕಪ್ ಮಾಡಬೇಕಾದ ಪರಿಸ್ಥಿತಿ ಇದೆ ಅಂತಲೇ ಅರ್ಥ.
Proteinuria can be there even without seeing froth. That is one more thing. And it is important to check the blood pressure also.
ಡಾಕ್ಟರ್, ವಾಟ್ ಆಲ್ ದ ಡಯಾಗ್ನೋಸಿಸ್? ಈಗ ಒಂದು ಪೇಷಂಟ್ ಬರ್ತಾರೆ ನಿಮ್ಮಲ್ಲಿ, ಯಾವ ಲಕ್ಷಣಗಳು ಇರುವುದಿಲ್ಲ, ಆರ್ ಸಂಬಡಿ ವಿಲ್ ಹ್ಯಾವ್ ಸಮ್ ಸಿಂಪ್ಟಮ್ಸ್, ಹೌ ಯು ಸ್ಟಾರ್ಟ್ ದ ಡಯಾಗ್ನೋಸಿಸ್?
That means how to screen for chronic kidney disease. The best part in nephrology is that all test is very cheap. Everything can be done at a cost of maybe less than rupees 500. Okay, so the basic test is you can send a serum creatinine. It is cheap.
ಸಾಮಾನ್ಯ ಬೇಕಾದಂಥ ಮೂಲಭೂತ ಏನು ತಪಾಸಣೆಗಳನ್ನು ಭಾರಿ ಕಡಿಮೆ ವೆಚ್ಚದಲ್ಲಿ ಒಂದು 500 ರೂಪಾಯಿಯ ಆಸುಪಾಸಿನ ಖರ್ಚಿನಲ್ಲಿ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗುತ್ತೆ ಅಂತ ವೈದ್ಯರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
Yes, it is cheap, easily available. We'll get the report within probably 1 hour. So important test is all patients when we are suspecting kidney disease or for general health evaluation, we have to send a creatinine, a urine analysis. Urine analysis just to check whether there is increased protein excretion in the urine. The better investigation will be urine ACR or albumin creatinine ratio, which is the ratio of albumin to creatinine in the urine, which when it is high we will know that there is increased protein being excreted in the urine. And other also simple and cheap investigations such as ultrasound abdomen pelvis. We will be seeing the kidneys through the ultrasound scan, and we can easily detect any kidney stones is there, whether in the ureter or in the bladder or in the kidney itself, whether that is causing obstruction, and because of the obstruction whether there is back pressure changes causing hydronephrosis. We call it hydronephrosis, back pressure changes. So these things all can be done with a very simple investigations called ultrasound scan, which is available in the present times it is available everywhere, and these blood investigations are also very simple.
If you trace there is some problem in a kidney, how the treatment starts?
Yes.
And what level of treatments are required?
Definitely. The treatment for CKD is a progressive disease. So what we have to mainly look is what has caused the CKD. Like if diabetes was the cause of CKD, then it is very important to, according to guidelines, what we tell is every year, at least once in a year, a creatinine has to be checked, the urine has to be checked. We have to slow the progression of the kidney disease. So the best way to slow the progression is to reduce the protein being excreted in the urine. How to reduce the protein being excreted in the urine? That is with certain medications. And also very good optimal BP control. Blood pressure has to be very well controlled within that correct range. It should be ideally, we tell in a young person BP should be less than 130/80 in a person who is already diabetic, because once the blood pressure shoots up, it is always 200, 210, then obviously the kidney disease progression will be faster. Second, the protein excretion will have to come down, we'll have to reduce it by certain medications. We call it AC inhibitor, ARB. Once the creatinine goes to a certain level, we may not be able to use that. Then so second is to whatever is the cause of kidney disease, that has to be treated. If the stone was the cause of kidney disease, we have to remove the obstruction. Once the obstruction is relieved, the kidneys also is expected to improve, and it can come to the baseline. Creatinine can come to the baseline.
In what time this replacement?
Yes.
Kidney replacement.
Kidney replacement therapy or renal replacement therapy. There are two modalities. That is dialysis or renal transplantation. That is done only at the end stage. That means usually patients will present with uremic symptoms. What are those symptoms? That is decrease in appetite, decreased food intake, when they look at when the food is kept in the table, dining table, so they feel nausea, sensation of nausea. They will there may be episodes of vomiting when they wake up in the morning to brush the teeth. Nausea sensation or vomiting sensation can be there, and there may be
ಸಮಸ್ಯೆ ತುಂಬಾ ಗಂಭೀರವಾದಂಥ ಸಂದರ್ಭದಲ್ಲಿ ಅವರಿಗೆ ಈ ರೀತಿಯ ಪರಿಮಳದ ಸುವಾಸನೆ ಸೆನ್ಸೇಷನ್ಗಳೆಲ್ಲ ಕಡಿಮೆ ಆಗುತ್ತೆ, ಆಹಾರ ಬೇಡ ಅಂತ ಆಗುತ್ತೆ, ಬೆಳಗಿನ ಜಾವದಲ್ಲಿ ವಾಂತಿಯ ಸೆನ್ಸೇಷನ್ ಎಲ್ಲ ಆಗುತ್ತೆ ಅಂತ ವೈದ್ಯರು ಹೇಳುವಂಥದ್ದು.
There can be itching all over the body.
ಎಲ್ಲ ಕಡೆ ತುರಿಕೆ ಇರುತ್ತೆ ಅಂತ.
And feeling of tiredness, weakness. Maintaining a normal hemoglobin is also one of the function of kidney. So when at the end stage, CKD stage 5 or ESRD, usually the HB hemoglobin level also comes down. That will just add to the weakness, the tiredness, weakness, fatigability. At any time at that immediately you will have to check the serum creatine, urine routine.
Yeah, doctor, the transplantation.
Yes.
What is the success rate?
The success rate depends on many factors. Actually, if it is first degree
ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಮಾಡುವ ವಿಚಾರಕ್ಕೆ ಅದು ಎಷ್ಟು ಫಲಕಾರಿ ಆಗುತ್ತೆ ಅಂತ ವೈದ್ಯರ ಹತ್ರ ಕೇಳಿದೆ.
Definitely renal transplantation is the better option compared to dialysis in many of the patients, especially in non-diabetic individuals, young people, where the expected lifespan and the expected graft or the kidney which has been transplanted from the donor will be about 15 to 20 years if the kidney has been taken up from a first degree relative.
Okay.
So what we usually a patient on dialysis we tell 3 years the survival rate may be 50%. 5 years the survival rate is less than that. The 5 years the survival rate of a person is less than 50% or a patient on dialysis. What I remember my sir who has taught me nephrology, he has told that a 30-year-old person on dialysis is the same as an 80-year-old person not on dialysis. So 80-year-old otherwise healthy person and a 30-year-old, see, we don't be surprised when an 80-year-old person dies, but we get surprised when a 30-year-old person on dialysis dies. So that's why renal transplantation is definitely the better option, because it increases the lifespan, it increases the graft survival. The graft is usually has got a very good survival, especially taken from the first degree relatives, that is brother, sister, father, mother or children. Then the graft lifespan will be better.
Yes. ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಇವತ್ತಿನ ಏನು ಆಧುನಿಕ ತಂತ್ರಜ್ಞಾನದ ಕಾರಣದಿಂದಾಗಿ ಎಲ್ಲ ರೀತಿಯೂ ಅದು ಫಲಕಾರಿ ಆಗಿರುತ್ತದೆ ಅಂತ. ಎಸ್ ಡಾಕ್ಟರ್, ಎಟ್ ದ ಫೈನಲ್, ಎಟ್ ದ ಎಂಡ್, ಹೌ ಟು ಪ್ರಿವೆಂಟ್ ಕಿಡ್ನಿ ಡಿಸೀಸ್?
Yeah, how to prevent kidney disease means we'll have to do screening periodically.
Okay.
That is one way. The good thing is
ಆರೋಗ್ಯವನ್ನು ಕಾಪಾಡಿಕೊಂಡು ಇರಬೇಕಂದ್ರೆ ನಾವೇನು ಮಾಡಬೇಕು ಅಂತ.
To improve the awareness among the people, among the general public, to screen for the kidney. Once now, fortunately, before joining for any institution, they do a pre-employment checkup. That is good. So sometimes patients come to us. On pre-employment checkup, we notice that there is protein being excreted in the urine, and that has brought them to us, and we diagnose them early. So early the diagnosis, earlier we can start the treatment, slower will be the progression. Sometimes we may be able to cure the disease completely. That will be very good for them.
Any modulation in lifestyle is necessary?
Yes, definitely. The first thing what we have been taught is, the first thing is obviously the diet and lifestyle modification. So maintaining a normal blood pressure, normal blood sugar is important. So salt restriction. Once there is already hypertension, we'll have to restrict the intake of salt. Once there is already diabetes, we'll have to take a diabetic diet. Maintain a normal BMI, body mass index, and do regular exercises. Maybe 20 to 30 minutes a day of brisk walking has to be done 5 days a week. That will help in maintaining a normal BMI, normal blood sugar, and other we call it metabolic syndrome. Means diabetes, hypertension, obesity, increased uric acid, all come together as a package. So that has to be treated first.
Yes. ವೈದ್ಯರ ಪ್ರಕಾರ ನಮ್ಮ ಜೀವನ ಶೈಲಿಯಲ್ಲಿ ಕೂಡ ಸಾಕಷ್ಟು ಬದಲಾವಣೆ ಮಾಡಿಕೊಳ್ಳಬೇಕು. BP ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗದಾಗೆ ನೋಡಿಕೊಳ್ಳಬೇಕು, ಶುಗರ್ ಲೆವೆಲ್ ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗದಾಗೆ ನೋಡಿಕೊಳ್ಳಬೇಕು, ಒಂದಷ್ಟು ದೈಹಿಕ ವ್ಯಾಯಾಮ,
ಫ್ಯಾಟಿ ಲಿವರ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಕಂಟ್ರೋಲ್ಡ್.
ಎಸ್ ನಾನು ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ಸಮಾಪನ ಮಾಡ್ತಿದ್ದೇನೆ. ಅನೇಕ ವಿಚಾರಗಳನ್ನು ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು ನಮ್ಮ ಜೊತೆಗೆ ಹಂಚಿಕೊಂಡರು. ಹಿರಿಯ ಕಿಡ್ನಿ ರೋಗದ ವಿಶೇಷ ತಜ್ಞರು ಇವತ್ತಿನ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ಭಾಗಿಯಾಗಿ ಯುರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಆಯೋಜಿಸಿದಂಥ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ಡಾಕ್ಟರ್ ಥ್ಯಾಂಕ್ ಯು, ಥ್ಯಾಂಕ್ಸ್ ಅಲಾಟ್.
ಥ್ಯಾಂಕ್ ಯು.
ಎಸ್ ಈ ಒಂದು ಮಾತುಕತೆಯನ್ನು ಇಲ್ಲಿ ಸಮಾಪನ ಮಾಡ್ತಾ ಇದ್ದೇನೆ. ಯುರೋ ಹೆಲ್ತ್ ಪ್ಲಸ್ ಆಯೋಜಿಸಿದಂಥ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ಭಾಗಿಯಾದಂಥ ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರಿಗೆ ಮತ್ತೊಮ್ಮೆ ನಾನು ಪ್ರೀತಿಪೂರ್ವಕವಾದಂಥ ಧನ್ಯವಾದವನ್ನು ಸಮರ್ಪಣೆ ಮಾಡಿ ಈ ಒಂದು ಮಾತುಕತೆಯನ್ನು ಇಲ್ಲಿ ಸಮಾಪನ ಮಾಡ್ತಾ ಇದ್ದೇನೆ. ಥ್ಯಾಂಕ್ ಯು. ಆರೋಗ್ಯ ಕಾಳಜಿ ಮಾತುಕತೆಯನ್ನು ಕೇಳಿದ್ದಕ್ಕೆ ಆಲಿಸಿದ್ದಕ್ಕಾಗಿ ನಿಮಗೆ ಮತ್ತೊಮ್ಮೆ ಧನ್ಯವಾದಗಳು. ಥ್ಯಾಂಕ್ ಯು.